Before using your Autopen, ask your diabetes specialist for the Autopen that best suits you. Using the Autopen is so easy. Just pull the cap, unscrew the body from the cartridge holder, check to ensure that the internal plunger is fully retracted. If the internal plunger is extended, rewind it by holding the lower part of the body between the thumb and finger. Turn the body until the internal plunger is fully retracted. If using longer-acting cloudy insulin, you will need to resuspend the insulin by turning the cartridge up and down and rolling it in the palm as per the instructions supplied with your cartridges. Load the insulin cartridge into the holder with the metal cap first. Screw the cartridge holder and body firmly together. Attach the unifying needle by firmly screwing it onto the end of the cartridge holder. Remove the protective caps from the needle. It is important to prime the Autopen before use to remove any air that may be inside the needle. Dial 2 units on the dose selector. Hold the Autopen with the needle pointing up. Push and hold the release button towards the needle until the arrow on the pen body points to the starting line on the dose selector. Remember, push down and hold. Repeat these steps until a drop of insulin appears at the needle tip. Your Autopen is now ready for use. First, make sure the arrow on the pen body points to the starting line on the dose selector. Then dial on the dose selector the dose your doctor or diabetes educator has told you to use. Insert the needle, push the release button down and hold. Remember, hold until the dose selector returns to the starting line. To make sure you get the full dose, always count to 5 slowly and then remove the needle from the skin. Reattach the protective needle cap and remove the needle. For improved diabetes control and your comfort, use a new needle every time. Dispose of the used needle carefully into a sharps container. If the dose selector stops before reaching the starting line, this indicates the insulin cartridge is empty and you will not have received the full dose. The dose selector will clearly indicate how many more units must be injected to deliver the complete insulin dose. To change the cartridge, unscrew the cartridge holder from the body and remove the cartridge. Rewind the internal plunger, then insert a new cartridge. Screw the cartridge holder and body together. Attach the needle. Prime and inject any remaining units if necessary.
So now I know how to use the Autopen, where should I inject?
Well, there are several places you can inject, but each injection must go into the fat layer under the skin.
Okay.
You may want to choose the outer part of the arms, your stomach, the tops or the outer part of your thighs, and maybe your buttocks if you can reach them.
It is important to keep rotating your injection site to avoid one site becoming sore or difficult to inject.
The preferred method of injection is with the pinch-up technique. This is where the skin is squeezed between the thumb and forefinger and the needle is then inserted at a 90-degree angle.
As you can see, using the Autopen is quick and easy, so you can use it to take your insulin anywhere, discreetly and comfortably.
It's small and neat, and I love the very, very tiny needles.
And patients are happy with it.
And it's a one-handed operation.
It's smooth action.
Because it's easy to use.
You're a one-man survivor. You just take care of yourself.
There's no place where we can't do it.
To find out more about Autopen, you can contact your local Owen Mumford subsidiary.